treating the terrain of the individual. This would be sort of the Becamp theory or philosophy of the individual is what matters and their health, the host health. And then on the other side would be directly targeting the microbe, more of the Pasteur argument, which is you need to treat the pathogen. Together seems to be where one achieves the best outcome. And we've seen this principle most namely with fungal or candida overgrowth. When combining diet along with antimicrobial therapy, the results may approximately double when adding diet to some sort of killing agent. So it makes sense that we'd see the same thing here. So foundationally, sleep, exercise, stress. Now, looking at a couple of these, some people may not be able to sleep well. They're doing all the things, like I mentioned earlier, but they still can't sleep. So this could mean that one of these organisms is present. Or stress. What if you have a lot of anxiety and you say, gosh, I'm taking walks, I'm spending time in nature, I'm meditating, but I still feel anxious. Okay, do your best, realizing that part of the limitations here might be resolved when treating one of these organisms. Diet, especially thinking about what is the best diet for your gut type, because the gut has such a substantial impact on the immune system. And then gut health supports, again, because the gut is so important for systemic immune function, we want to make sure the gut's in good working order first. And also because we may have improved tolerance to whatever the therapeutics are if someone has improved gut health. So that's foundation. And for most people, I think it's important to start there and build up some resiliency and also simultaneously reduce some reactivity before then going into the antimicrobial therapy. And that's important because, and I'll see this in the clinic where people are so gung-ho to go blasting after the organism. And I totally get it when you're not feeling well, but we want to set you up for success. And this is something that years and years ago I had discussed with SIBO and why some people seem to improve when treating small intestinal bacterial overgrowth short term and then relapse because they haven't laid the appropriate foundation first. So then whatever antimicrobial or antibiotic therapy they do, the results are short-lived. So same principle applies here. Okay. And by the way, if this has been helpful, please comment and subscribe. I really do appreciate hearing what people think. So I'll look forward to reviewing your comments. Regarding the targeted antimicrobials, coming back to the heuristic I laid out before, I look at these as treating a protozoa versus treating bacteria. So Babesia versus Bartonella and Borrelia. So for the bacteria, again, remembering that especially with the herbals and the natural agents, they oftentimes will hit multiple mechanisms or both protozoa and bacteria at the same time, but there are some skewings that we can use. And I've shared before the table we've been developing, and a huge credit to Dr. Zhang on this, who's done a lot of the research showing the activity of different botanicals or herbals against different organisms, and even the types of organisms, meaning are they growing, are they in biofilm, so we can really be fairly precise. Bacteria. For bacteria, so Borrelia and Bartonella, garlic, oregano, clove, and cinnamon may be some of the best. Additionally, especially for Bartonella, methylene blue, which is actually a medical dye, can be quite helpful. With one very important caveat, you cannot do high-dose methylene blue if you have a deficiency of what's known as G6PD. It's a blood test that you can run at LabCorp or at Quest. Very important before you go on to higher dose methylene blue, because methylene blue is often used in higher doses, 5 milligrams, 10, maybe 15, maybe even up to as high as perhaps 50 for mitochondria and cognitive function. It's going to have some low-level antimicrobial activity at those doses, but you can go as high as 300 milligrams twice per day to treat Bartonella. Again, do not do so until you have confirmed you do not have a deficiency of G6PD, because if you do, it can cause damage to your red blood cells, which can be quite serious. It's not very common, but it's just a smart screening to undergo. The protozoa, the Babesia, This is where different herbals can be used, like Artemisia, Cryptopolis, or Sida. Now, medications like antibiotics for the Borrelia and Bartonella, being bacteria, and then antiprotozoal drugs, usually these are just taking from antimalarial drugs like atovaquone or tefenaquine, can be used to treat babesia. But I wanted to come to some of the wonderful research from Dr. Zhang. Quoting his 2017 study, we were able to identify 23 essential oils at 1% concentration, so not super high doses, that are more active than the control persister drug daptomycin. So he compared herbs against a control antibiotic, and here's what they found: that oregano, clove, cinnamon highlighted themselves as having a remarkable activity even at very low concentrations. Why the Zhang research is so pivotal is when it comes to the area of what's known as vector-borne infections, or Lyme, the more antiquated label. There's certainly a bias in the research toward pharmaceuticals, toward antibiotics. And it's not because the herbals have been studied and demonstrated to be ineffective. It's just due to a paucity of research. So this is why the Zhang research, even though it is in vitro, is still very interesting. And you'll see, and you do see, many clinicians in the field, myself included, who are seeing clear responsiveness with the herbals. People have die-off, then they feel better. You start them on a second treatment that's herbal in nature, a little more die-off, and then they feel even better. You can use the antibacterial antibiotics or the antimalarials. I do have concern with the antibiotics for obvious reasons, because oftentimes the treatment here is not a month. It's usually 3, 4, 5, 6 months, maybe even longer. So using antibiotics for that long, and also if someone has an underlying predisposition to fungal overgrowth, would make me much more apprehensive about using antibiotics. A couple other things on treatment. As we discussed, these organisms can create biofilms or more viscous blood. So things that treat biofilms and or make the blood less viscous can be helpful. Modulation of inflammation can also be helpful. And this is where things like ginseng, ashwagandha that are adaptogenic also have a time and a place. And then finally, hyperbaric oxygen therapy, also known as HBOT, can improve mitochondrial function, can improve circulation, can disrupt biofilms, can improve immune function, both being anti-inflammatory, helping the immune system function more effectively, and can even have an anti-aging effect by stimulating stem cells. Stumbling blocks. I think the die-off is something that, especially if you are an individual who's had a history of food reactivity, supplement reactivity, maybe environmental reactivity, and you're fairly attentive to how you feel, you go into some die-off and you back off and say, oh, it was a reaction, I'm going to stop. So this is where I do think this is an area wherein having a clinician who can monitor you and help orient you to big picture and are you on the right track will prevent what seems to happen in some of these situations, which is I do a little bit of treatment, I pull back, I'm not sure what to do, I go off, I read on a blog about all these things that can treat the symptoms, like natural ways of quelling anxiety or depression. I spin my wheels, and then when I report back to my healthcare provider, I haven't followed through with the original recommendations, and then I've tried a few different things. And so you don't really have any good data in terms of, okay, we're going to change this one variable, see how you do, keep our perspective macro, meaning looking at a time span of 2 to 4 weeks rather than 2 to 4 days, because there can be micro fluctuations. And like I said, you can get a little worse before you get better. So having the confidence and the experience to be guided through that, I feel, can be quite helpful. And then another stumbling block, depending on your history here, if you've done more conventional treatment with antibiotics and you felt like I just didn't get better, or maybe even I got worse, that might be due to exacerbating a pre-existing fungal overgrowth in the gut. And we do have good tools here namely another questionnaire by Sandelman, the FRDQ7, which is a questionnaire that will give you a risk quantification for fungal overgrowth.